COVID-19 online webinars. Today's topic that we're dealing with is the occupational health surveillance of COVID-19 South African workplaces, a very important element of the growth of our topics. We have quite a distinguished list of guests to deal with this very important national tool, and I'm going to immediately ask Dr. Spoor Galamono to do the welcome on behalf of the NIOH. I'm going to ask her to share her audio and video. Thank you, Dr. Spoor.
Good morning, everyone. Dr. Spoor Galamono, I'm the occupational medicine specialist at the
Dr. Spoor, are you unmuted?
Hello, can you hear me now?
Yes, I can. Thank you. Please proceed. And if you could maximize your slide, Dr. Spoor, thank you.
Good morning, everyone. I hope you can see my slides now.
Yes, thank you.
Okay. I wish to welcome you all to this important seminar where we're going to guide you through the submission process as a compliance to the direction from the Department of Employment and Labor. So thank you so much for joining into this seminar. And before maybe I hand over to the rest of the presenters, I thought maybe let me just say a little bit about the National Institute for Occupational Health, seeing that most of you might not know what it is for and where it is. So the NIOH is actually a division of the NHLS. A lot of you might know about the NICD. So NICD is our sister company. So NHLS reports to the National Department of Health. So the NHLS then has a few entities, one of them being the National Institute for Communicable Diseases, the NICD, and then it's the NIOH, which is the National Institute for Occupational Health, our institute. Then we do have laboratory service with a national footprint, and we also have a corporate office where all our corporate functions sit. Our mandate as the NIOH, we have a multidisciplinary function to develop and support occupational health and safety in the whole country. The work of this institute is a mixture of technical and professional activities to support the development of policy, professional capacity. We do train, we do a lot of training, teaching and training, both academic and non-academic. We contribute a lot to legislation formulation and development and regulations. We do partner with other governmental departments, especially the Department of Labor, in terms of contribution to legislation development. We also provide coordinated disease and injury surveillance, hence you are on this webinar, specialized services and strategic services, including laboratory services. So our partners, we have partnerships with trade unions, NGOs and business and civil society, also with government and any other public entity. We do have local and international partnerships. And of importance is we do have quite strong links with universities across the country and other institutions of higher learning. So in a nutshell, I'm going to just talk through the services that we have. Our services, we respond to the outbreak, as all of you might have noticed during COVID, where we trained quite a lot of people. A slide had come up there. We have done about 55 or so seminars, and we've trained about more than 34,000 participants. We generate knowledge, especially from research activities. And as I said earlier on, we have specialized services in the form of our labs and also advice to all stakeholders. So these services, we offer them through our pathology section, which largely does the autopsy service, postmortems for specifically for ex-miners, but for also current miners. Occupational medicine, which runs an occupational medicine clinic, occupational hygiene, which has quite a lot of AIAs in that section, and immunology and microbiology section, toxicology section, epidemiology and surveillance, the head of which is going to tell us more about the surveillance. We also have analytical chemistry, HIV and TB and health systems and information services. And we also have our SHEC department, which is not only for the NHLS, but also assists outside. And also the National Biobank sits within the NIOH. I am running through them quickly. The point is not to go in depth, but to whet your appetite and give you a little bit about the Institute. So, you are welcome, please, to go to our website and check all the activities. We have a wealth of information on the website. Our website is 0 rated, so please feel free to go and check a little bit more about our services and what we stand for. We are for anyone within South Africa, whether in the public sector or private sector, informal and formal economy. That's who we are. So welcome to this seminar today, where we hope to guide you through the submission process for COVID surveillance. So thank you so much for your participation. We hope that you benefit from this seminar, and I will then hand over to Mr. Ashraf Rightleaf to take over the proceedings of the day. Thank you so much for joining. Thank you.
Thank you. That's Dr. Spo Khalamono, the head of occupational medicine, and also during the COVID-19 surprise pandemic and epidemic within South Africa, was heading the NIOH for the period in setting up everything up, including the COVID-19 outbreak response team headed by Dr. Tanusha Singh, and this initiative of the online Zoom webinars. And yes, we've trained over 34,000 attendees in 55 sessions under the leadership of Dr. Spo. Thank you very much for that, Dr. Spo. I'm now going to immediately hand over to Dr. Tanusha Singh, and apologies, Dr. Nisha Naika. That was a slip. In the absence of Dr. Singh. So yes, this session is about surveillance, and Dr. Nisha Singh Naika, apologies, is the head of epidemiology and surveillance and public health specialist at the NIOH. I now hand over to you, Nisha, if you could just share your screen and unmute your microphone. Thank you very much.
Hi, thanks Ashraf and Dr. Spo. So I'm just going to run through a brief overview of the occupational health surveillance system for South African workplaces. So currently we know that there is a lack of adequate data regarding occupational health itself and the impact of COVID on various business sectors in South Africa. Since the start of the pandemic, there have been attempts to collect data, and there's been reporting processes for employers, but this has not been coordinated or fully implemented throughout the country. And now with the level 1 lockdown being initiated, more and more workers are heading back into the workplace. And as we are moving further down the levels of lockdown, it is much more important now to monitor the situation in the workplace, whether the exposure is from the community or the workplace. Since more workers are heading back into the workplace, we have to look at what is happening and how this impacts on the business sector itself, and what are the trends facing the country with during this impact of COVID. So The occupational health surveillance system was thus created with the following objectives: to develop a framework for a COVID surveillance model for monitoring workers in various economic sectors, both in the public and private sector, early identification of the sectors and companies and occupational groups that are at high risk of infection, so that appropriate interventions can be initiated, whether it be different policies in the workplace itself or national, provincial policies, programs, resources can then be adequately allocated or efficient use made of these aspects. Could also evaluate the impact of COVID, the actual interventions in the workplace. We can see whether the cases are plateauing, decreasing, or rising based on after the interventions have been initiated. To determine, eventually we'll be able to determine the impact on human resource and the economic impact on the various businesses and the sectors. With the surveillance system, we'll be able to provide regular updates on the trends of the pandemic nationally. And with all the information that we will be obtaining, we'll be able to see or identify additional key scientific questions that might require further investigation. So with this, the occupational health surveillance system was then initiated by the National Department of Health, together with the National Institute for Occupational Health and the National Institute for Communicable Diseases, NICD, the CSR, and with partnerships with the business private sector, B4SA, and occupational medicine specialists from several universities, particularly UCT and UKZN, has initiated this system. So this delivery team is backed by a sound governance structure, and it consists of the steering committee, which is made of government departments, the National Department of Health, the National Institute of Occupational Health, NICD, CSIR, Department of Employment and Labor, Compensation Fund. As I said, also includes the business sector, the labor representatives, representatives from the scientific committee, and representatives from the data management and technical committee. So the data management committee consists of IT staff from NIOH, CSR, and business experts. And in addition, we have the scientific committee that is responsible for scientific validity of the data being collected, the data quality, its routine reporting, and for formulating research questions that will aid us in mitigating the impact of COVID-19. So the occupational health system is not an isolated system. It will receive data from various sources and process this data to achieve the outcomes that we want. So the following data sources will be connected with the system from NICD, that's the notifiable medical conditions, and the Sentinel hospital admissions databases, the NHLS laboratory testing data, as well as private laboratory testing data, the Compensation Fund, National Department of Health, Department of Employment, Labor, and the mining sector as well. So the data received will be confidential. Data in the data lake will be anonymized and any identifying information removed after a period of 6 weeks. And all of this data will be securely stored at the NIOH and processed within the NIOH. And like any of these large data sets, all systems will be monitored regularly for any security vulnerabilities. So the leaking of confidential information or identifying information is not really a major issue because of all the security that is in place. So I'm just moving on now to the categories of data to be submitted. If you had read the directive from the Department of Employment and Labor released in on the 28th of September, you would note that there are several categories of data that has to be mandatory to be submitted. And these are the vulnerability assessments, which includes the that applies to the comorbidities and risk factors for an employee having a more severe outcome from COVID, the symptom screening, a positive case data and high exposure work contact data, and then following that is the return to work data. So I'm just going to go through the different templates for data submission, and the first one is the vulnerability assessment, and this is a once-off submission of data. So this assessment, so everything highlighted in red is the compulsory data that has to be submitted. So it is the employee ID, which can, in this case, be the employee number that the business gives the employee, could be a unique identifying number generated by the business, or it could be the South African national ID number. So it's up to the employee and the business to decide how they want to identify the employee. The business ID is the number that is generated by our surveillance system and provided to the businesses. So each business has their own unique ID. Then it's the province, district, gender of the employee, the age of the employee, the job category, and there are specific job categories. If you look at our templates on the website, you will see the different types of job categories. It's just 8 broad categories that you would have to decide where that worker falls in. Then the vulnerability status, and all we require that is mandatory to send to us is a yes or no. Yes, this employee is vulnerable, or no, not. If you have the information highlighted in blue, this can be, and you have permission to send it to us, this can be sent. So that is all the comorbidities and the risk factors being age greater than 60, pregnancy, if you receive the flu vaccine, etc. So that data is not mandatory, as I said. And this is a once-off data submission that you will send to us soon after you have registered on the portal. The screening data, and this is collected daily from employees, and it's submitted weekly into the system. So it's not reported every day, and it's only reported on those employees that have been symptomatic. So if for a week you had no one that has been symptomatic, no symptom screening data will be submitted. So again, it's all the information in red is mandatory, and all the information in blue is voluntary. So some businesses are collecting specific symptoms, and then these can be sent to us. But if you are not, all we require is yes or no answers. Positive test case data, this is submitted when there is a positive case. And if you have several positive cases during the week, you can submit this also on a weekly basis at the end of the week. Again, everything in red is mandatory. But in this template, employee ID and a South African national ID must be sent in. So if you have used another employee ID, that is a unique ID generated by the business, or you have used the employee number, the normal business employee number, then you have to add that plus the South African national ID, as well as the business ID and all the other information required. We need the South African national ID for the positive cases, because we need to then use this to match with the notifiable medical conditions data and the hospital data, the lab data, etc., and as well as the compensation data. So two IDs are necessary in this template, and then the rest of the information in red has to be submitted. So including the test type, whether it has been a PCR test, which is the most likely test available, and currently there are labs that do the antibody tests. Symptoms positive, yes or no, and then the For the contacts, all we require is the number of high-risk contacts within the workplace. So the positive employee had high-risk contact with the following number of people. So it's just a number, and a high risk has been defined in various guidelines from the Department of Health, and it just means that a person that is within 1.5 meters distance from the positive person with for more than 15 minutes and has not used a PPE or a mask, appropriate PPE or a mask. We also require vulnerability status, yes or no, and then exposure information as well. The return to work data. So when the positive COVID positive employee returns to work, then this report will be submitted. Again, it can be submitted on a weekly basis. So again, we need the employee ID, which is just either the business ID or the unique ID generated by the business. And all data that is in red is mandatory. What is important here is that we would like to know what was the outcome of this employee after attaining COVID, after becoming COVID positive. So were they hospitalized, yes or no? And when they did return to work, what was the date of the return to work, and were they fit for their job description, or did they need some sort of accommodation? And then whether there was a compensation claim or not. So the process in order to start submitting is that you need to confirm for yourself whether your business has 50 or more employees per site. And this is explained in the directive by the Employment and Labour, as well as the National Department of Health guidelines that was released earlier. Again, and then once you have all the relevant information, you then register on the Occupational Health Surveillance System registration portal, and that is the link. After registration, you will receive an email confirming that you have registered. Just moving on. So this is the business registration page, and this is the information, type of information that is required. So everything that is that has an asterisk required is mandatory information. So the business name, the type of industry you belong to, and there is a drop-down box, and you just select from there your address. The province is the province and the district of the main company. So if you have multiple branches, those branches will not be added at this stage, but just where the head office or main company or the registered company is located. We need a contact name and a contact email and contact numbers, so that if additional information or missing information is found, there is somebody that we can connect with directly. The sector affiliation, so if you are in a bank, you belong to the Banking Association of South Africa, or the motor industry. So that is the type of sector affiliation. Then we also need the number of total employees, female employees, male employees, and these totals have to match. So the number of female plus male has to match the total number of employees or add up to that. And then we need additional information on the employees within this job categories, and then the type, how would you like to submit your data? And Dr. Mitsweni and the IT team will describe each of that a little later in this webinar. So once you've registered, as I said, you'd receive an email confirming the registration. And then in that email, you will receive your business, and then you will receive an email after that stating your business ID, the username and password with the link to the submission portal that you have decided on. So if you have decided on API or CSV submissions or to use the CMO, that specific link will be sent to you, and then your submissions can commence. So for more information on all of this can be obtained from the NIOH website on at this link on the OHSS business portal for businesses in South Africa. For any queries, these are the following email addresses that would work, specifically OHS support for IT queries, but all other additional queries can be sent to us at OHS Workplace. Okay, thank you. Thanks, Ashraf. That's all from me.
Thank you very much. That was Dr. Nisha Naika, head of the Epidemiology and Surveillance section here at the National Institute for Occupational Health and a public health specialist at the NIOH. Thank you very much for that, Nisha. And you've gained us a little bit of time. So a reminder, there was quite a bit of information in those slides. The links and email addresses and other things you need to know. Just a reminder that these slides and presentations will be made available to all of you. And as one attendee already asked, it will be uploaded to the NIH's website. As Dr. Spoors indicated, is a zero-rated website for you to access all of the COVID-19 materials, including all the recordings for this particular webinar. A very quick reminder then, please everybody, if you've got a question specific to our topic and presenters, please type that in the question and answer box. For all in any other query, any other question, admin related matters, please only use the chat box. Thank you very much. So a quick overview of all of our presenters following the introduction, the welcome and introduction by Dr. Spoor and Dr. Nisha Naika is Professor Mohammed Jibe and Professor Rajan Naidu, who will be dealing with legal and ethical aspects. Following that is Dr. Jabu Mtsweni from the CSIR, and he will be dealing with the introduction to the submission process. That is the submission of data for this particular surveillance tool. And Dr. Mtsweni will then proceed also to give you an idea of how to submit to the CMOR platform on a step-by-step basis. That's followed by Mr. Faisal McKenna from the NICD, that is the National Institute for Communicable Diseases, our sister institute, and he will deal with the submission of the CSV on a step-by-step basis. And then Mr. Monty Rambao from the NIH IT team as well will be dealing with the API step-by-step submission process. Then we end at the end with what happens to the data. And this is the dashboard demonstration by Mr. Reshlabili Khutlang, and he is from the CSIR. And my understanding is together with the other colleagues, he's played a key role in the development of this very, very important national tool that we need to utilize. So having said that, I now need to hand over to Professor Mohammed Jibe and Professor Rajan Naidu. And as they are activating the links, presentations and microphones by way of introduction, Professor Mohammed Jibe is an occupational medicine specialist and holds joint appointments as the head of Occupational Medicine Division in the School of Public Health and Family Medicine, as well as the Department of Medicine at the University of Cape Town. Prior to this, he was the head of department and director of the School of Public Health and Family Medicine, that is from 2012 to 2017. Professor Jibe established the first occupational medicine specialist training program at UCT in 2004 and also convenes the MPhil Occupational Health and PhD program in occupational medicine. He has served on many statutory committees of the National Ministries of Health and Labour relating to the occupational health and safety. He's a previous recipient in 1998 of the International Award in Occupational Health and Safety of the American Public Health Association. In 2011, he was accepted as a fellow of the Collegium Ramazzini, which is based in Italy. He's rated by the National Research Foundation as an internationally acclaimed B2 rated research scientist. Last year, he was elected as the chair of the Environmental and Occupational Allergy Group of the European Academy of Allergy and Clinical Immunology for the 2019-21 term. I welcome you, Professor Jibe. Thank you for joining us and sharing your knowledge. And once you hand over to Professor Naidu, I will do a very brief introduction of Prof. Naidu as well. Thank you. Over to you. Prof. Jibe, if you could just unmute your mic, there you go. And maximize your slide, please. Thank you.
Good morning, Ashraf. Can you see me? Ashraf?
I can hear you. Your audio is perfect, and I can see your slides. If you could just maximize the slide again, it was maximized for a moment.
Okay. Yes. Can you see it now?
There you are. Thank you very much. Yes, it's maximized. Please proceed.
Okay. Okay. Good morning to all of you, and thank you very much for inviting me to share with you some of the legal aspects with regards to the occupational health surveillance system for South African workplaces in relation to COVID-19. What we're going to share with you is trying to get a better understanding of the legal requirements so that you understand why the particular sets of data that Nisha had mentioned in her presentation needs to be submitted. This particular legislation and requirement is the outcome of multiple consultations at NEDLAC between the various stakeholders that ultimately agreed for this particular data to be reported and presented. So what are the legislation related to the COVID-19 epidemic? Basically, they are governed by two major sets of legislative requirement. As we all know, the overarching legislative requirement is the Disaster Management Act and its regulations. And secondly, and very importantly, are the directives that are issued by respective government departments that is within their scope to legislate. And in our particular context, the main departments that we would be referring to are the Department of Employment and Labor, the Department of Health, and also the Department of Minerals and Energy. However, I'm not going to cover the specific requirements with regard to the mining sector. I'm going to cover the broader requirements that apply to most sectors in the country. So I'm not going to go into details around that, but just for completeness sake, there are various regulations that were promulgated under the Disaster Management Act that were promulgated in May and then thereafter in June, and then the most recent one was in September of this year. And they all speak to the requirement to report data by workplaces in some form or the other. And that is what we are going to talk about further in relation to the specific directives that have been promulgated by the national government departments. And by far the most important in relation to these are the consolidated COVID-19 direction on health and safety in the workplace, which outlines the requirements after consolidating the various requirements from various other aspects of legislation into one piece for workplaces so that they can then use this as the basis for the submission. The other important piece of legislation is the specific direction on the compensation for workplace acquired COVID-19 disease, which falls under the ambit of the compensation fund in the Department of Employment and Labor. And together, these two are the main legislative underpinnings that have been referred to by Nisha when she presented the type of data that needs to be reported. As I mentioned, There are also guidelines for a mandatory code of practice that have been circulated by the Department of Mineral Resources and Energy under the Mine Health and Safety Act, but we are not going to be talking to this piece of guideline in this presentation today. There are also other general legislation. Again, I'm not going to be talking about this in detail, but I'm sure there are a number of you who have comments and questions, especially with regards to issues such as why do I have to report, and there are issues around privacy of information and confidentiality of information, and these particular pieces of legislation form the other underpinning with regard to the ethical issues that Rajan will be also talking to after my input. So then let's go to the consolidated direction on health and safety in the workplace that was promulgated by the Department of Employment and Labor. And the first important section with regard to data is section 4.1, which states that if a worker has been diagnosed with COVID-19, the employer must do three things. One, inform the National Institute for Occupational Health in accordance with the specific guidelines directly or through an employers association. As some of you may recall, or most of you would have recalled, that previously this requirement for submitting of data needed to go to the NICD that Dr. Khalamono spoke about earlier. So this is one of the big changes with regard to where the information needs to be sent to, and now needs to be sent to the National Institute for Occupational Health. The National Department of Health guidelines with regard to submission of data has been circulated, and it is also located at the NIOH special COVID-19 website section, which has all the guidelines that have come through our Occupational Health and Safety National Task Team. Apologies. The second important requirement is to inform the Compensation Commissioner with regards to someone having acquired a work-related COVID-19 infection, and this follows the similar guidelines as other submission of COVID claims. However, there is the special legislation that I mentioned. And thirdly, the employer must give administrative support to any contact tracing measures that need to be implemented by the Department of Health. So then let's go through in more detail the legal requirements that are contained in section 4.2 with regard to the kind of data that needs to be submitted, which Nisha had also referred to. Very importantly, you're going to see a lot of repetition here, but hopefully by the end of this webinar, you will be very clear on the 5 sets of data that need to be submitted. Firstly, the law requires employers to report on each employee's vulnerability status, and it is a simple yes or no is the basic requirement. However, as Nisha mentioned, there are other aspects that could be submitted with the with the worker's consent. Secondly, the details of COVID-19 screening of employees who are symptomatic. So in this case, one would need to submit the details of those, only the numbers of those that are symptomatic. Thirdly, those who are found to be positive, their details would need to be submitted and reported. Fourthly, the number of employees that have been identified as high-risk contacts within the workplace. And the high-risk contacts have been defined by Nisha earlier on, greater than 1.5 meters for more than 15 minutes. And then fifthly, the details of the post-infection outcomes of those testing positive. And this basically means whether the person had recovered, had been hospitalized, and what the outcome was, and also whether they have returned to work and whether they are fit to continue working. So these are the 5 important core information that needs to be submitted by all workplaces, all employees, my apologies, who have more than 50 employees on their books. The second important aspect in section 4.2 is the frequency of the data that needs to be submitted. So this is also legally outlined. The vulnerability status is a once-off submission. Secondly, the frequency for all other data is on a weekly basis, as outlined in the legislation that refers to this particular aspect. The law also requires the employer to inform its employees that a submission has been made based on the legal requirements. And the law also makes provision for data to be either submitted directly by the employer to the NIOH or via an association who could submit their data on their behalf. And this, obviously, there is an administrative process with regard to that needs to be completed with the NIOH. So in summary then, these are the major sets of data that need to be submitted. The positive COVID-19 test, one would need to submit the employee's details, and also secondly, the number of high-risk contacts that that particular individual has had in the workplace. Secondly, the numbers of those that have screened positive and what kind of symptoms they have reported. Thirdly, the vulnerability status, and this is a simple yes or no. In terms of the categorization of what a vulnerable worker is, this has been outlined in the Department of Health guidelines on vulnerable workers, which is, also contained in the NIOH website for COVID-19. And then finally, the post-infection return to work details, as has been mentioned by Nisha, with regard to the outcome, and secondly, with regard to the fitness for work aspect. So I'm going to end then with a quote from Tom Frieden, who is the former CDC director, in relation to his comment around COVID-19. And basically what he says is that a country that responds well to COVID is not one that has consistent policies, but one that has policies which are responsive to the data. And that is really what this particular requirement is about. And ultimately, the success of us in terms of intervening on COVID-19 will be to a large extent dependent on our surveillance systems and the quality of our data, so that we can then identify hotspots and very quickly deal with them, so that we do not have second or third surges, as has been the case in countries north of us. I thank you very much. Thank you. And I'm handing over now to Rajan. Sorry, over to the chair, who will then hand over to Rajan. Thank you.
Thank you very much for that, Prof. Jibe. I mean, that was very clear in terms of the importance of this particular tool. I'm now preparing to invite Professor Rajan Naidu to share his presentation and to unmute his microphone. By way of introduction, Professor Rajan Naidu is an associate professor and head of department in occupational environmental health at the University of KwaZulu-Natal and has been in academic research for over 35 years. Sorry, that's 25 years. I've added 10 years there. His areas of research focus on occupational environmental respiratory diseases, with projects are funded by major national and international agencies, including the National Research Foundation, the US National Institutes of Health, the European Union, and the AstraZeneca Trust. He has over 95 peer-reviewed publications with presentations at several international conferences. He's also on the advisory board of International Archives of Occupational Environmental Health and the American Journal of Industrial Medicine. He received his postgraduate training in occupational medicine at the University of Cape Town and his doctorate at the University of Michigan. I am pleased to hand over to you. Thank you again for joining us, Professor Naidu. Over to you.
Thank you very much, Chair, and thank you to the organizers of this seminar for inviting me to do this presentation. I think we're at a very important point in the epidemic, and at this point, as Prof. Jibai indicated in his last slide, understanding the trends of the epidemic and the trajectory based on the data that's available to us is critical, and therefore this occupational health surveillance system that we're talking about is particularly important because workplaces are likely to be the key drivers of the epidemic in the next phase. Don't seem to be able to shift my slide. I'm going to focus around the issues of the ethics and the submission of data to the surveillance system. This is obviously an issue that brings up a whole host of concerns from employers through to the individual patients themselves, workers, around the issues about confidentiality, what can be shared, what cannot be shared, and are we likely to impact on workers' rights during this epidemic. Clearly, we have to find the balance between individual rights as well as promoting public health and how we move forward in trying to address the issues around the epidemic. We know that workers as patients are protected by the National Health Act because ourselves as health professionals are guided by the National Health Act. But at the same time, as citizens, workers are also protected by the Protection of Personal Information Act. And we need to make sure that we, with the data that we submit into the occupational health surveillance system, that we act within these the parameters of these laws. So the National Health Act guides our ethical conduct. But there are certain instances where we don't require patients' consent. So, and this is a key issue that has come up repeatedly around the submission of data to the surveillance system. Are we allowed to? Can we do this without the patient's or workers' consent? What can we submit? What can't we submit? So clearly, if the patients themselves are not able to provide consent, which doesn't apply in our instance here, if we are mandated by law, as Prof. Jibai has indicated quite clearly, the data is required by law. If there's a public health risk, and we know that with the epidemic, the manner of its spread, it becomes a public health risk. It's not just the individual's concern, but it is the contact that the individual has with the general public. We're allowed to breach confidentiality in terms of the National Health Act if, one, the patient gives us written permission. Once again, if it's mandated by law, or failure to act will result in serious public health. For example, if a patient comes to a doctor and says, I intend to kill a person, then the doctor has to breach confidentiality in that instance. So clearly, these are important concepts when we're talking about submission of data to the surveillance system. In terms of breaching confidentiality, what the law does not specify is who can be the recipient of this health information. So once again, here you're guided by individual rights. So in other words, the patient tells you, I give you permission to inform my employer. So the person has allowed the health professional to breach confidentiality with that specific instance to that specific third party. So in this instance, we need to make sure that when we collect data from our patient, from the workers, we're informing them that the data is going to be submitted to a third party, and that third party is mandated by law to collect this data. And if we do that, then we're well within the ethical guidelines. So when we look at the epidemic COVID-19 and disclosure, as Prof. Jiba has indicated, the COGTA regulations have clearly prescribed that there must be collection of information at the point of testing. In other words, a whole range of individual personal information must be collected. And the regulations also prescribe that this must be submitted to the DG of Health. What has happened then is that the DG of Health has passed on this responsibility to the National Institute of Health based on the guidelines that have been presented and have been circulated about how this data must be collected and what data must be collected. Okay, so although there's the individual does not have to consent to this for this disclosure, there's an obligation that the confidentiality must be maintained in certain manner. So disclosure is permitted once again if it's authorized by the regulation and it's necessary to intervene in the spread of the disease. But in all of this, the patient or the worker must be informed that this information is going to be passed on. Although they don't have a right to say, you're not allowed to do this, we need to inform them, and we need to inform them about what is the nature of the information that is being passed on to the third party. And within this, there are clear disclosure limits guided by ethical parameters and by professional boundaries. So the health professional is bound to submit testing data to the DG of Health. There's no ethical issues around that. That is legally mandatory. If the worker or the patient is positive, the professional is bound to inform the employer in terms of the public health risk containment. So once again, there's no ethical issues there. But within the occupational health surveillance system, we ask you for information on vulnerability of the workers, clinical management, and post-infection details. The law is silent on that. There's nothing in the law that says that this has to happen. These are now coming through in the guidelines that have been put forward by the Department of Health and by the requirements of the occupational health surveillance system. So that's where we go into the gray areas around ethics, which I'm going to try to address now. So I only became aware of this regulator in the last few months as we started working on the surveillance system, but there is a information regulator that is a statutory structure under the Justice Department. And they put out this very important guidance note relating to what personal information. So their task is to protect personal information that is collected by anybody in South Africa. So the regulator recognized that personal information needs to be collected in order to curb the spread of COVID-19. And that's the core of the occupational health surveillance system at this point in the epidemic. And they also say in 4.3.1, it is not necessary for the responsible party, meaning the NIOH in this instance, to obtain consent. But this is only when it comes to processing the data. It must be done according to the obligations imposed by law. In other words, the NIOH is acting as a accountable party to the Department of Health, which has a legal mandate to curb the epidemic and to look at ways in which they can intervene. And the collection of data is one of the ways in which the Department of Health is intervening. They may also collect special personal information. Now, special personal information defined by the POPI Act is information such as health data, your political choices, sexual preferences, etc., etc. As far as we're concerned, we're collecting special personal information related to health. And once again, by the virtue of the office and the task designated and the mandates designated to the Department of Health, this information is permitted to collect. Then what about workplace? Employers, in terms of protecting their workplaces, ensuring that workplaces are safe and healthy, they have to collect information about infections that may be transmitted by their employees. On the other hand, the health professional is not ethically bound to divulge information without the consent from the patient about vulnerability. In other words, the health professional does not need to say to an employer that your worker has severe hypertension. That's not a requirement. They don't need to say to the employer that I'm now admitting your employee to the ICU because he has severe COVID pneumonia. So once again, it's a question. Now we know that this information may not be then available to the employer and therefore cannot be submitted to the occupational health surveillance system. So if we look at what are the aspects that we need to submit and what are the ethics related to this. Firstly, we need to submit information on positive workers. There's a legal obligation to report this to the Director General for Health, and therefore there's the ethics is quite clear there. The positive symptom screening, there is a legal requirement to submit those people who are positive, have positive symptoms, but there is no obligation to submit personal identification. So there's no ethical impediment. Contact data, here, as Dr. Naika indicated, we only require the numbers of people with high exposure contact, and no identifiers are required. Therefore, there's no ethical impediment. Vulnerability status, once again, a legal requirement, and we're not saying that there's an obligation to submit specific health data if this is not available and this has not been consented for submission by the worker. You don't need to submit things like HIV status. All you need to do is to say whether an individual is vulnerable or not, based on the information provided by the health professional assessing that individual. Post-infection status is exactly the same. What we need to know is, has this individual come back to work, and has this individual been assessed to work in a particular, with a particular restriction? That's all the information. We do not need to know any medical information here. So once again, there's no ethical impediment. So this is the summary. There are 4 aspects which we're requiring, 5 aspects. I've omitted the one here. 5 aspects which we're wanting information. The positive test, and here it's a legal requirement, and there may be ethical concerns because you're submitting personal identification information. Positive screening, the legal requirement. There are no ethical concerns because personal identification is not obligatory. Contact information, which is not on the screen, is a legal requirement. Here we only require numbers, so there's no ethical impediment. Vulnerability status, no ethical impediment because we do not need health details. Post-infection return to work, once again, no ethical impediment because we don't need personal identification. I hope this addresses some of the concerns around ethics for the people in workplaces, and thank you very much for your attention. Over to you, Chair.
Thank you very much. That's Professor Rajan Naidu from the UKZN, giving input there on the ethical aspects and the importance of observing those ethical aspects in relation to this important national tool. Prof. Naidu, if you could just unshare your screen, thank you. Okay, so and I have the pleasure of introducing to you Dr. Jabo Mtsweni from the CSIR, who's going to do two elements of our program today. One is the introduction to the submission of data processes, as well as how to submit the CMO platform step by step. And thank you for all of you for your questions in the question and answer box. Some of your questions will also obviously be covered have been covered by the presentations by Prof. Jibai and Prof. Naidu, and will also be covered now by Dr. Mtsweni's contribution. So by way of introduction, Dr. Jabo Mtsweni is head of the Cyber Information Security Center at this Council for Scientific and Industrial Research, the CSIR, a member of the Data Research and Statistical Stream supporting the NAC joints and NCCC. That's the NCCC. Technical lead expert and steering committee member of the Occupational Health Surveillance Systems, that's the OHSS, research fellow at the University of South Africa, and a board member at Directorate of Information Warfare in the Department of Defense. Dr. Mtsweni has been involved in leading and supporting and implementing large and complex ICT and cybersecurity projects locally and internationally, including projects in large state-owned enterprises in South Africa and in the African continent for government departments and military. So with that, a few words of introduction. I hand over to you, Doctor. If you could just share, your screen is shared already. If you could just open your microphone, thank you.
Thank you very much, Chair. I hope everybody can hear me and you can see my screen. I'm also going to...
Yes, thank you. Your sound is perfect and your screen is clear. Thank you very much.
Thank you. So I will try to go through the registration process because there are a lot of questions around it. And then after that, I would quickly just show you how the CMO platform works. But I think it's important for us to explain to you all the various options that are available for a company to actually submit their data. So the first thing that is very important is obviously the registration process that Nisha has already explained earlier on. The registration process is happening on the NIOH website. The link will be made available to you, but if you check on the screen, there's a link there, ohss.nioh.ac.za. So when you go into that website, you would then click on the link that says register. When you are registering for the company, as Nisha showed, you would then fill in all the necessary information that is required. But my focus is more on the three options that are at the bottom that you need to look at in terms of submission. And these three options, you need to consider them based on what is possible for your company, how you could submit the data. The first option, which Faisal will explain a bit more about it, this is what we call sort of the next cloud or the manual option, so to speak, because this one, it requires you, if you have, for example, the templates that are also available on the website, you could then populate these templates, vulnerabilities, screening, and so on and so forth. And then you then upload them onto the NIOH using your username and password that would have been shared with you. Faisal will explain a bit more on how to actually complete the form. Maybe one other thing I just need to explain as I'm talking about the manual option, the templates, when you receive them, they are in Excel format. If you are unable to change them to CSV when you submit, you can leave them as Excel. We will probably have to deal with them on our side, but normally we would prefer that after you have saved your information into those files, you just save them as CSV format because it makes it easier for us to automate the process. If it's in Excel, we can still work with it, but the process may just be a bit more laborious. So once you are registered, the process is we would then in the background have to verify the information that has been provided to confirm the registration details. And then once the registration details are confirmed, including the option that you may have chosen, a unique business ID will be generated. And this unique business ID would then be sent to you via email. It is only sent to the person whose email address was provided when the registration was taking place. And it is important as well, just for me to clarify, that the registration for a company, you are only required to register once. If, for example, you are company X, you just register once, irrespective of the number of sites that you may have. The differentiation that you could make in terms of the different sites is probably maybe the district where the site is at, or it could also be the province. If, for example, it's in a different province. If the sites are probably within the same district and the same province, you could just choose a unique way of in the province or in the districts just to separate them. Even if you use a unique number, it's just that you just have to be consistent once you have chosen that. And then you can compile all of this information in one, I'm talking about now the manual submission. You could compile it in one a spreadsheet, for example, for screening, and another spreadsheet for vulnerabilities, another spreadsheet for positive outcomes, and another one for return to work. And as I think they've mentioned already, the most of the data that is submitted regularly is more the screening information. For example, every week you may submit, in terms of the positive screenings. Now, there was a question that has been asked whether if the persons are not positive, do we have to submit? So it depends. Normally, if you submit the data, we are able to filter between the positives, in other words, symptomatic, and the ones that are not. So it will greatly help us if you submit on a regular basis, so that we can at least know that we have submitted, even though there may not be any symptomatic cases. So that's the first option. So you would see that the unique ID that is shared with you is the one that is shown here on the screen. Of course, it will differ from one organization to another. And the reason we are using this unique ID is to ensure, obviously, that as the data is being reported upon, the names of the organizations are not exposed unintentionally, including the aspects of the user. So in the templates, one thing that is very important, particularly for the screening, and I think the others, we don't require the ID number per se. So you could choose, for example, let's say the staff number as one of the indicators, so that at least we can be able to link them across. But for positive cases, because this needs to be verified even with NICD, that's where the ID number, the real ID number, is required. But one thing is, in the form, there is no name of the employee that is required, including the address where they are staying, and so on and so forth. So you don't have to provide that information, particularly from the screening point of view. There was a question as well on how do we determine if somebody is asymptomatic. When you look at the form, as Faisal will explain, there are just yes or no questions. So if somebody has one symptom, then the symptom outcome will be positive, and so on and so forth. So and the process of submission, you will see with regards to the Nextcloud, is pretty much simple. It's on the browser. You just dump the file there, and we are able to archive the information. Now, because some other organization may want to access their data later on, we would be able to archive that information maybe from compliance purposes. However, one thing that is very critical is when you submit your data is only accessible by yourselves and the data team. So other companies may not be able to see other companies' data, and this applies across the different submission criteria. Then there's a second option, which is the API integration, and I think Monty and Tsumbezo will explain this one. This is more automatic in a sense that if you are already using tools within your environment and you want to just integrate directly, so that as people are completing their screening, as an example, that information is submitted directly without you having to manually do it. And we may not necessarily cover all the technical details in this session, but the team would go and explain to the technical guys on how that should be done. But the same process follows. Once you register and you have chosen the API integration, you would then get a username and the password and regarding other keys that are necessary for API integration. However, the business ID remains the same, which you will obviously have to use as well when you are submitting the data. The last one is the CIMO one. CIMO is more the web app, but it also comes with the mobile application, and I will explain briefly on how that should be done. Now with CIMO is if you want to collect this information, for example, as employees are coming into the organization, you have an administrator sitting there, maybe at an entrance to capture this information or something like that, particularly from the screening point of view. So you would have that. But once you register on the Nextcloud, you would also get a business ID, and then you would also get a username and a password to be able to access the CIMO, the CIMO system. Normally the email is generated automatically. And again, if you have one company in different sites, it is better to just register once. Should you need, for example, to register multiple ones, just send us an email, because we may want just to create a different username, or the challenges may be you may just now have to share that username with the other colleagues on different sites. The reason is one company is only considered once on the system with the business ID. If people are in different provinces, the forms and the different system accommodate for you to indicate as such, including the various districts. So what I will do is, just before I finish here, is in terms of the entire system, it is differentiated into 3 options, as I've mentioned, is for the organizations that do not have their own tools. And that's, if you don't have your own tools, you can use CIMO and you can use the Nextcloud option. That's the manual submission. If you have your own tools that you're already using and you don't want to change from them, but you are comfortable with the API integration, you can choose the API integration point. So, and then all the information is stored at NIOH, and this information is not necessarily available through the everyone. So even when the people are submitting the information, they are only submitting it into a platform where they have access, but the actual data is saved outside that particular environment. So just to allay maybe fears of security and stuff like that, we also make sure that once the information is consolidated, it is not available within this environment. So even if there was a breach, the breach could probably only affect just the information for specific companies, but not for all companies. But ultimately, the idea as well is once the companies have submitted, we would normally remove the data from here and be able to store it within the data lake, particularly from the analytics point of view and so on and so forth. Now, I think they've spoken about this particular option. This is the registration form. The preferred data submission processes, they are here at the bottom. So when you choose them, just be careful of why you, the different ones that you are choosing. CSV is the first one that probably can accommodate almost everyone, especially from the manual submission point of view. The CIMO platform is when you want to submit as people are coming in, you want to use tools, you want to avoid maybe getting it in a spreadsheet and submitting later on. I'm just going now to go through the second portion of my presentation, which just deals with CIMO. So the CIMO app, from the CSR point of view, this is a platform that accommodates a number of data submissions, and I'm going to show you the demo very quickly. So we've got the web platform, which I think many organizations would find it much easier to use, especially when you have to, let's say, screen people as they are coming in and you don't want to do it manually. I will show you the various screens now. However, what is very important is when you are submitting on this particular platform, the only thing that we need is obviously the business ID that you enter once. And then at the other instances, when you're submitting, the business ID is already there, it's sticky, then you just enter the unique ID, for example, of the user. And you could choose in your organization how you want to identify users, particularly for the symptom screening and the vulnerability and the return to work, you can decide. But for positive tests, you need to submit the ID. And one way is to choose maybe your staff number, is 0812, and then you use that number throughout. So it becomes easier for us to be able to consolidate the information and to be able to correlate and stuff like that. Now, one other thing I want to mention here is the platform, because it is not just used for the NIOH data submission. We use it for various other systems that collect data. you would find that in many other cases, they may require location information when you are putting the data. In your case, you don't have to put that. It's not necessary. You can switch off the location if you want to. It is not required. And then in terms of the operators, you know, sometimes you may see that other companies may have submitted the data or something like that on CIMO, but you will only see the data that you have submitted. And the reason you may see sometimes other operators I will show you is because this is a collaborative platform where people, for example, like when we're using it at Kruger National Park, could be chatting on the system. But in this case, when you submit the data, it is only visible to the data analyst at the back and to NIOH. The other organizations who may also be using CIMO, they won't see the same data that you are submitting because you are not on the same platform. And then there is another option as well, which may be a bit problematic if you want to do it manually, where there is a mobile app as well, which you could use as we have said at a gate or something like that. As people come in, you would then have these different templates again, you know, symptom screening, positive test, and so on and so forth. But as we have said, some of these like positive test and vulnerability and return to work, they are not submitted on a regular basis. So the one that probably could be useful is the symptom screening, where at the gate somebody just completes it rather than completing the manual. And as they do that, the data becomes available in the backend. So the app is available on Google's Play Store. The slides will be shared with everybody, so you would have them. So what I want to do now, just to save time, is to just quickly go into the demo, just to show you how it works. Maybe if the chair can just confirm with me, if you can see the screen, then I will start showing you the platform quickly. Chair, is the screen visible? Can I proceed quickly?
Yes, your screen is visible. It's got the CIMO mobile app on it at the moment.
Okay, so I think I must just then stop this and share again so that I can show the platform itself. I hope the colleagues can now see the correct screen. This is the...
We see a screen with the map of Southern Africa, the CIMO screen. Thanks.
Yes, 100%. Okay. So when the colleagues have registered for, let me see if this thing will go away. When the colleagues have registered, they will then go into this website, which will be shared with them on the registration, and then they will be able to log in. You know, of course, I don't want to log in again, but you log in with your username and passwords that have been shared. You can still change the password, you know, by going through the profile and be able to change your profile. So you can come there and change it, you know, including changing your name and so on and so forth, and putting the old password, the username and the password. So you will get a default password, and then you can change that for yourself. And then normally what you do here, it's very simple. Once you're on the website and you are putting now the submission, the only thing you do for every screening, for example, you click on the new event. It takes you into this screen where all the forms are at. It's like 4 of them. So this is more what we call a tag. The positive one, the return to work, the symptom screening, and the vulnerability. For simplicity's sake, the process is the same for all of them. I will just click on the symptom screening. So on the symptom screening, the only thing you need is the employee ID, the business ID, which you will type. For example, in this case, 1234. The consent, it was there in the beginning to say, have the employees given consent for this? So in many cases, you can keep this to true. And then you can then here enter the employee ID, in this particular case, the one that you might have chosen for that specific employee, or let's say the employee number to make things simpler. Then you can enter the age, you know, whatever the person age is, and then whether they are male, the job category. Currently, we're using the OFO codes. So that's the ones that we have for now. Which you can, depending on the category where the employee is, you can put it across there. For example, if somebody is working in the front desk, you can choose that one. You can choose the province, you can choose the district where they are. And then if you wanted to go further within the province to choose, okay, I think I made a mistake here. If you want to choose a district, you can do that. And then here you can tell whether somebody is got to, if they have no symptoms, you can just put a description that you want no symptoms or whatever. The date, you don't have to put anything, it will be automatic. As you can see here, you don't have to put anything with regards to the address unless you wanted to, but it's not necessary. For example, those people who have different sites, you know, you could use this as a differentiator if you wanted to use it to show that the people are at different sites, so you can do that. And then that's just about it. You know, if there is no symptom, it will be false, but if somebody has chosen one as true, then you do the symptom as that. And then you just create an event. Once you create an event, it will just come in there and then you will be able to see. So if you check here on the side, you would see that this is the people who have added, but you won't be able to see the data. You know, this will only be seen by yourself. The reason, as I mentioned earlier, it's more from the collaboration point of view. And that's all. And then we have submitted. Once you have done this, we would then have the data. It's very important to know that CIMO, you can't really use it for bulk submissions. If you want to do bulk submission, rather choose the Nextcloud, because here is to help you as people are coming in, and then you can submit there. So there are various of them. It's the same process. And I think, Chair, I will stop there. Thank you.
Thank you very much. That was Dr. Jabum Tsweni for that particular input, and very practical and very clear. There are some key links that all of you need to be aware of, and we will be sharing those links to you. I now invite Faisal McKenna from the National Institute for Communicable Diseases IT team, who's been a critical member of putting all of this together. Faisal, if you could open your microphone and share your screen. That will be great. Over to you, Faisal.
Hi, afternoon, everyone. I'm going to start sharing my screen now, and then I'll what Nextcloud is all about, and how we are going to submit manually onto the Nextcloud. I want to share the whole screen.
And my sense is this is a live demonstration, Faisal? Faisal, if you could just unmute your microphone, we can see the sharing of the Excel sheet entitled Return to Work Template. Whilst we are waiting for that to be completely shared, a reminder, please, people, just type questions only in the question and answer box, as your general comments in the chat box. I will be sharing a link that Prof. Jibe has posted also in the chat box to guide you in the chat box as well. And as we end the session, I will have a series of slides that's going to give you that very same link to the NIOH's website, as well as the email address if you've got any follow-up questions with regard to this particular tool. I hand over to you, Faisal. You ready?
Okay, apologies for that. Chair, are you able to see my screen? Which screen are you seeing?
I'm seeing your desktop.
Perfect.
With the
yeah, I want
icons.
to share my desktop. Perfect.
Please proceed.
Okay, so the first thing you'll see after you've registered, you'll see you can go to the NIOH website, which is https://www.niOH.ac.za, where you can go and download the templates so that you'll be able to upload them to Nextcloud. So on the home screen, you can go to COVID resources, and then in there, you'll find the 4 templates that you can use to upload your data. Once you've got the templates, you'll get these 4 templates, which is your return to work. And then in your return to work, you'll find that the different tabs where you can, the list with if once an employee returns to work. But I think where I should start, let's start with the symptoms. No, vulnerability. You would start with your vulnerability, would be your first upload that you do most probably you've already identified all your employees and all their vulnerabilities. So you'll use this template to fill in your information. You can use the list to look at the different vulnerabilities, and a dictionary would then guide you on the vulnerabilities that you're supposed to report on. You'll then save this file as a CSV without the list and the dictionary part of the file. On an ongoing basis, you then do screening data, where as soon as you get people with symptoms, you would then put in the different employees screening information into this. Again, there's a list and a dictionary with the different things that is required for the symptoms. And then we've also got a positive. Once you get a positive case, you would then fill in the positive case onto the spreadsheet and then save it as a CSV. Just demonstrate to you. Go to Save As, choose the directory that you want to save it as. You then click on down there and say Save as CSV, and you then have it as CSV. And then on an ongoing basis, as you are filling in those details, you then go to Nextcloud, which would be then, I'm going to just type in the URL, which would be https://nxt share.nicd.ac.za. It would then bring you to your home screen, and then the username and password that has been shared with you. And then you type in your password. Once you successfully logged in, you'll find that you've got your 4 folders: one for the vulnerability, one for your screening information, your positive cases, and the outcome of what happened to your employee once they became positive. Did they return to work? And let me close this file so that I can demonstrate how you would then upload them. So let's take your vulnerability. You'll click on your vulnerability folder. You click on the plus sign there on top. You go to upload file. It will automatically open your desktop. On your desktop, you can then browse to where you've saved your data. And then you click on the CSV file that you want to upload. Click open, and it would automatically then upload your vulnerability data. You can then go back to your home screen. Any screening data that you have, you can click on your screening data folder. Go to the plus sign, and then click on the upload file. And then you can then upload your screening data. The same you'll do for your outcomes and your positive data. Once everything is uploaded, you then click on logout. Just want to go and demonstrate, waiting for the files to be uploaded. You then see there, once the file is uploaded, you then see that your file is uploaded into Nextcloud. That is the manual submission. On a daily basis, on the background, we would then collect that file and then upload it into the data lake, where we would then process it so that we can then use it to guide us on how to deal with the COVID epidemic that we are currently experiencing. That is it from me. Thank you.
Apologies, I just realized my microphone is unmuted. Sorry, was muted. So thank you very much for that, Faisal McKenna, a member of the NICD, National Institute of Communicable Diseases IT team, sister institute of the NIH as part of the National Health Laboratory Services. I'm now going to introduce to you Monty Rambau from the National Institute for Occupational Health's IT team, who's going to deal specifically with how to submit the API step by step. Monty, I hand over to you.
Thank you, Chair. Good afternoon, everybody. Okay, so I'm gonna present the more technical aspect of showing the submitting data. So like Dr. Jabu explained, the API submission is more system to system submission, which will require some development from the submission side. So the link, so what we have done, we have created a test API where companies can go through and test their system before we can point them to our production data lake. So the first step would be, so when you register and you select API, we will send you your username, password, business ID, and basically a manual of what I'm about to show you. There has been a delay with specifically the API accounts, but we should start sending them out this afternoon. Okay, so the API test link would be apitest.nioh.ac.za. Again, it's a bit technical, but the development teams should be able to figure it out easily. So once you get here, there'll be a data submission button, which will expose the 6 endpoints. So the endpoints, there's one for logging in, logging out, submitting the screening data, the positive data, the return to work data, and the vulnerability data. All these are based on the templates that are found on the NIOH website. So how the process works, I will just quickly demonstrate. Once you register, like I said, you get your username. I'll just take a test one that we have. A username and a password that we will send you. And of course, the API key, which is important to validate and to ensure you are who you say you are, and so that we can keep track of the submissions coming in. Okay, so now on the Swagger or API link, this is where you test out the credentials that we would have sent you. So now I'm just testing it out. So it's complaining that we have the incorrect password, which it should. Just want to show you. For some reason, my system is deciding to hang today. Apologies for that. Okay, so the API will be a GUID like this. So when you test it out, your system should okay. So once you authenticate, the system will respond with a token and a message. So depending on the technology that you will be using, whether it be the PHP or the .NET frameworks, you should be able to continue from here. So once you have the token, you would then start a second process of submitting the screening. And here so the screening is submitted in JSON format. And here is a sample object to demonstrate in what format the API is expecting the data in. So again, to start the second process of submitting, you would enter the username, which will provide the business ID. Again, all this information will be in a single email, and the token. So the token basically starts a session which is valid for 5 minutes. If it will basically log the system out if 5 minutes of no activity. And you only need to authenticate once, then you can submit as many records as you have, but we would prefer you submit a payload of 500 records per push. So there would be the token, the username, and then two. So once you click here, it will populate the screening data with the sample data that we have put out here. And then you should get a response that you should be able to interpret and then proceed to submit again. And the same goes for the positive test data. There is a sample object here that will demonstrate which format is expected. Requires the same business ID. So the API does require the business ID every time you submit for each record, again, to identify and categorize the data correctly. The same goes for the return to work objects and the vulnerability object. So what we normally do, should IT teams have difficulty connecting and consuming the APIs, we can set up a quick team session so that we can walk through together with them while they submit at least 30 records to our test API. And once we are both happy, we will then redirect them to the live data lake. And that's it from me, Chair.
Thank you very much. That was Monty Rambau from our NIH IT team. Thank you very much for sharing the step-by-step API process. I now ask that's been covered, apologies, Mr. Reshlabile Khutlang from the CSIR to address us on the topic of what happens to the data, and this is the dashboard demonstration. And by way of introduction, Retlabile is a research group leader at the CSIR, that is the Council for Scientific and Industrial Research, responsible for secure identity systems, and works with Dr. Mtsweni to develop the dashboard analytics. Thank you very much. If you could just share your screen and unmute your microphone. Thank you very much, Retlabile.
Good afternoon, everybody. I just want to confirm if you can see my screen.
Yes, Retabile, I can see your screen. It is the NIH OHSS dashboard with the graphs, two types of graphs there, and I can hear you quite well. Thank you very much. Proceed.
Thank you. Yes, indeed. This is the NIOH OHSS dashboard. And this is all the data that we've been discussing that's being sent over to us. And this is what happens to the data once we have it. So what we have now is a dashboard that one would say is descriptive in nature. All that we do is we we collate all the data and try to pick up information that could be useful either to the NIOH or eventually to these individual businesses that are giving us data as they can see it. And the dashboard should be embedded on the website also. So what we have here is a dashboard that is very interactive in nature and is dynamic as we get more data pushed to us to augment the data that we currently have for the description of COVID-19, mostly like, symptoms, positive test, and the trends of the symptoms and test with time. And currently we have something like 6 or 7 pages that constitute the dashboard, and we actually could have more. And what we have on the dashboard, this is just the main page or the landing page, which actually can be changed or tweaked a bit with time. But what we thought we could have is we could have different tabs for different sections of the data. And we currently have from the home, we have the businesses that are currently registered, but we are careful not to show individual business names. Rather, we have sectors like different industries. And then we have the screenings that we currently have to date and the positive cases that that have been reported so far. And furthermore, we have vulnerabilities and return to work data. So what one could do with the dashboard is one can easily try to create reports that can be either saved or emailed from the dashboard for different use cases. But the whole idea is to have like one descriptive portal through which we can see, we can have an idea of how COVID-19 screenings and positive cases look so far. For instance, on this panel, we have the accumulative positive tests that are recorded per month from March when we first went into lockdown. And we can see how the trajectory has been growing for the total number of positives and either for the males or females as separate groupings. And then close to it, we also have like just a profile of the symptoms so that one can get an idea of which symptoms are more prolific with the different months that we have data on. And so far, we don't have anything for October. So the latest month that we have would be September. And then just to be more minute in description of the current data that we have so far, we have positive symptoms that have been grouped according to both the age and according to different job categories. So one can see per month whether we have positive cases or just positive symptoms. One can start having an idea of the contribution per different age group. So this would be on the landing page that does not necessarily have only our data, but we have, for instance, as some of the headline data points, we have the data that we have access to outside of the NIOH, like the total number of national positive cases and which of the total number are active cases, because we have to remove all those that have been recovered to have an idea of statistics like the recovery date, and we can easily change this to have more than just the daily cases that we currently display. So all these are dynamic. You'll all see information that's pertinent to the different filtering that you could have on the dashboard. As I've said, it's quite dynamic and interactive. So with regards to the businesses that we have registered, we don't necessarily have individual business names, but we have different sectors. We have, for instance, in Gauteng, well, as everything is partitioned according to province, we have under the chemical industries, for instance, like oil, rubber, and paint, we have 2 districts in Gauteng, one being City of Johannesburg and the other being Ekurhuleni Metropolitan Municipality. And you can have like the partitioning of people per gender, or you can have the actual individual sectors within this industry, whether what's the contribution of people from the elementary sector of the chemical industries, clerical, what's the number of the professionals within this particular sector only in the Gauteng province. And for each district, then you can have the percentage contribution for this particular province. So going forward, after I reset the filter that I had implied, we've started to have like some geographical distribution of the different sectors. And so far, we can see that the majority of the people are actually in the Gauteng province, as was the case in the previous panel. But we are able to have geographical distribution of number of businesses. And not only that, we actually are able to have to show which form of registration does the majority of businesses use. And as we can see that Nextcloud seems to be the preferred mode of registering businesses so far. And again, the majority of registrations are in Gauteng. So basically, we could have more, but what we wanted to show is the ability to have some geo description of the distribution of businesses in South Africa. And then further on, we have further descriptive analysis of both the symptoms and the summary of the screening statistics that have been collected to date. So for each province, we can have the description of symptoms that are relevant for that particular province for 1 month that's currently been recorded on the data that we have. And the filtering are across board. We're able to actually have the positive symptoms according to age and job categories only for the Gauteng province for the month of July. So the whole point is you should be able to see anything that you'd like, as long as you're able to filter for the particular province, the particular sector that you would like detailed screenings on. And we further have more analysis, which are not necessarily geographic, or they are not necessarily graphic in nature, because it was a bit tricky to have graphs on this symptom detailed analytics page. So in this case, that's where you have the particular numbers per province for each of the different job categories. But then again, we still do not have any individual businesses, but we have categories that have been filtered according to province. So the one thing that, well, that's worth highlighting is how interactive the dashboard is, and the fact that you can always save the different reports that you would like to have post filtering for the particular scenario that you'd like to see. So here we can simply see that with regards to trends, again, Gauteng had the highest peak around July, which was quite pronounced from the data that we have compared to other provinces. And again, the distribution can be per gender, and we can see that almost for all the months that we have data for, the females have been hit the hardest by the positive cases. So far we have, this would be the 7th page. We have 7 pages that we have like the provisional analysis of, but with more requirements, we could have further directed analysis. But what we have here was the broad description of both the symptoms and the positive cases that we have so far. In this last page, we are able to show that for the positive cases, were there any symptoms or were they not symptoms prior to the positive case being confirmed? And again, we can use the provinces to check per province what's the ratio of positive cases for different sectors. And these are all the sectors that we have so far, but we could have more should the need be. But in essence, this is the dashboard that we have that one can navigate through different pages, and with more requirements, we can have further pages or augment a few that we currently have developed so far. And we definitely can have further development on the geographical distribution of cases side of the dashboard. Thanks a lot. I'd like to stop here for now.
Thank you very much, sir. That was Director Bile Khutlang doing the presentation on how the dashboard is working, and he's from the CSIR. So we've reached the end of our presentations, and we've got a few minutes to answer some questions. My understanding is that there's a particular question that Dr. Nisha Naika wants to answer directly and live. So I'm going to quickly ask her to share her screen and her microphone. Also just quickly trying to find that particular question. Nisha, over to you.
Hi, Ashraf. Sorry, there must have been an error. Maybe I clicked something.
Okay, well, just from your side and also our other presenters, given the key questions being asked in the question and answer box, I think there's quite a lot of duplication and people asking similar questions. The one question that you have answered, for example, does the Seymour confirmation email, is it sent from a Gmail address? And you've answered a number of people, yes. It comes from Seymour, C-M-O-R-E, .server@gmail.com. I'm not sure if there's other similar questions that have been trending in our question answer box, Nisha, that you may just perhaps wanted to address. And I'm going to ask that also of Prof. Jibe and Prof. Naidu, if there is general comments of that they want to make and or emphasize based on the engagement of the question and answer section. Nisha, first yourself.
Yes, regarding the templates, a few companies have asked that if they have their own templates, can this be submitted? It can be submitted only if their templates, if their data points match our data points. So they either need to adapt their template or use ours to submit.
Okay. Prof. Jibe, Prof. Naidu, if I could invite you for any observations, important, I think, aspects that you would like to either emphasize or any gaps you want to fill. Prof. Jibe?
Thank you. Ashraf, can you hear me?
Yes, I can. Please proceed.
I am really quite pleased with the level of enthusiasm with which the questions are being asked. And one of the questions that trended was, do we need to submit retrospective data or only prospective data? So the answer to that is the requirement only. So the requirement to submit data only became effective once the directive was promulgated. So which means it's only for prospective data, from effective from when the directive was promulgated. Now, there are some companies who have collected a lot of data and who may be wanting to submit that data. As Nisha indicated, if it's easily done and it can be configured in the way that is possible, then they can do it on a voluntary basis. But the requirement in terms of the law is only for data collected from when the directive has been promulgated. Now, there's also two different sets of data. As we indicated, the vulnerability status is submitted once off. However, if your employee's vulnerability status has changed, then you obviously would then submit the new status for a particular individual. And so that is once off. And then obviously the other sets of data are submitted on a weekly basis going forward. Thanks. Over.
Thank you very much, Prof. Chibe, for that. Prof. Naidu, you dealt with the ethical aspects. There's one question asked by an anonymous attendee, or the question was posed anonymously. Could you please identify the implications of the POPI, and I would assume that's the POPI Act with regard to privacy in South Africa on business making personal information available? This remains a serious concern, as a business only makes personal information available on request at our offices. To say that it's not a concern and that your system is secure is based on what type of security and assessment? And perhaps you could start responding to that. I'm sure you've covered some of that in your presentation, but also to draw in our other colleagues, Dr. Nsweni and Retlabile, into that particular question. Dr. Naidu, sorry, Professor Naidu.
Thanks, Chair. So firstly, we clearly said that there's a legal requirement. So certain things, once they become a legal requirement, then the POPI Act allows for that data to be submitted. The other is that certain of this data that we are requiring is anonymous data. In other words, you're not obliged to submit the personal identification. And once you are no longer submitting personal identification data, then my understanding the POPI Act does not apply. But given that, for all of this information, because it is of a sensitive nature, the NIOH, as has been elaborated here repeatedly, has a whole range of safeguards in place. And this applies across the board to the collection of any data by the government. So those have a very high standard, and I think the relevant people have sort of expressed that. But the bottom line is the data is a legal requirement to submit, so the POPI Act makes allowance for this. Thank you.
Thank you very much, Prof. Naidu. So if I could perhaps ask Dr. Nsweni and his colleague Retlabile perhaps just to step in there and add anything that you think is relevant to what Professor Naidu just indicated with regard to this question about privacy.
I can just quickly come in. I think in terms of the privacy, security, and obviously confidentiality of all the data that is submitted. So all the three options have been tested for security over a period of time, I think since July or so. And as I indicated, every company will only be able to access only their workspace. So for example, in cases where a company maybe may have decided to share their users, the usernames with somebody else, those persons may only have access to that data only. And as I mentioned earlier as well, the data is not publicly facing, because once the company submits, the data goes into the data lake, which is not publicly accessible by anyone. So even if there was a breach, we might not have that particular problem. But of course, we are not claiming that there's any system that is 100% secure, because the breach could happen anyhow. So, but at least from what is reasonable possible, we have put in all the mechanisms in place and the systems in place to ensure that at least whatever data is submitted is kept safe.
And I assume that your team will be keeping a watching eye and monitoring the level of security of the system on an ongoing basis.
Yes, definitely. As I said, we have been doing regular checks on it, and we will continue to do that as the data is submitted.
Thank you very much for that. We have reached the end of our session. I'm not sure if there's any of our colleagues, Prof. Jibai, Prof. Naidu, you yourself, Dr. Nsweni, Faisal, Monty, Rekhabile, if there's any, and obviously Dr. Naika, if there's any final comments you want to make, I will give you an opportunity if you want to to add something. Please just indicate.
Can I just quickly
check?
Yes, please proceed, Nsweni.
So I think there was just two things I wanted to address. Many people were asking after the presentations whether they can change the options. They can. They must just send us an email, then we'll be able to adjust that. And there was a question about CMO username. So if somebody has a CMO username, they cannot use it to access the other system. So all the, like the Nextcloud, you can only use it on the Nextcloud. You can't use it elsewhere, same as with the API. So they must just make sure that when they change, they send an email to OHS workplace@nioh.ac.za, and then we will be able to accommodate them. There was another question quickly where people wanted to use multiple options. We could accommodate them, but because of the workload now, we would request them to at least maybe just use one option for now. And then as support becomes easily available, then we can accommodate multiple options. Thanks.
Thank you very much. Did I see that you wanted to add something, Prof. Naidu?
Yes, thanks. So I saw there was repeated questions about the vulnerability data submission. Should it be only for workers who are vulnerable, or should it be for all workers? So we're saying it's for all workers, a yes and a no. So that's one. The other was a repeated question that came up is effective dates. So the intention is for people to get this information. I don't think there's a legal specification in the direction, but we want this information as soon as possible because it's now a legal requirement. And certainly if factory inspectors come to your doorstep and you've not submitted this, then you're breaking the law. Thank you.
Thank you very much for that, Professor Rajan Naidu from UKZN, who's dealt with the topic of ethical aspects and have contributed as part of the bigger team to the development of this particular national tool and system. Are there any final other comments, Nisha, or anybody else? If not, then we will conclude this particular session.
Ashraf, could I say something?
Please proceed. Thanks.
Yeah, there have been a lot of questions around screening and basic information. I would strongly recommend colleagues who have not read the most recent directive that came out that outlines all these procedures very clearly. And so that is the one set of document which everyone should review, which is on your NIOH website. And then there are the associated guidelines that speak to health monitoring, that speak to vulnerable employees, that speak to data submission, and that outlines the detail that is contained in the specific directive requirements. So both of those sets of documents are crucial to better understanding what the issues are and how to operationalize them by virtue of following the guidelines that we have compiled and put on the NIOH website. Thank you, over.
Thank you, Prof. Chiba. And yes, I noticed that you have shared that a link to the guideline with one of the attendees, and it was also then posted on the chat box for all attendees to see that particular link and guidelines. That's where I want to conclude today's webinar on the occupational health surveillance system, and that's the occupational health surveillance of COVID-19 in South African workplaces. And you've heard from our panelists, and that's the welcome by Dr. Spochana Mono, the head of our occupational medicine section and occupational medicine specialist, Dr. Nisha Naika, who's the head of our epidemiology and surveillance section, responsible for liaising with this amazing team, national team dealing with this particular system, and having done all the hard work of putting together this webinar and all our presenters. And then again to Professor Muhammad Jibe from UCT, Professor Rajan Naidu from UKZN, thank you very much for your input and time and sharing your knowledge and guiding of all of our attendees, all of those in the workplaces that would have to use this particular system. And then Dr. Jabum Tsweni and Ritlabire Khutlang from the CSIR, thank you for your contributions. And then also my colleagues in the IT sections of the NICD, as well as the NIOH, and that is Faisal McKenna and Monty Rambau. Thank you very much, Faisal and Monty, for your contributions. And then also on the list, we have colleagues like Janet Manganyi, the head of our occupational hygiene section, who's also been having a watchful eye over our proceedings and assisting as generally as a panelist, and the head of our IT section, and that's Ola, Ola Ken, who's been supporting this process as soon as he joined the team. And from myself, Ashraf Raycliffe, the National Occupational Health and Safety Training Manager here at the NIH, I thank you all for joining us today. You are reminded that all of our presentations will be uploaded onto our website, that is www.nih.ac.za. And the slides I'm going to show now as we conclude my screen is going to have the key email address that you would need to contact, and that is, as mentioned earlier, the OHS workplace, OHS workplace at nih.ac.za, and there will be a link or two that will be flashing on the screen as well. So thank you for joining us. Keep well, stay safe. Goodbye, and join us on our next webinar.